Okay, so next speaker in the program now, Professor Lars Montelius, Director General of INL. I'm sure that is going to also to bring us a surprising presentation. I'm going to put on the spotlight now for the Facebook transmission.
Thank you so much. Thank you, Paul. So I will start by also sharing my screen here, trying to do that at least. Share, right. I guess you can see it now, right? So I will join principally what Sergio spoke about a little bit about the possibilities of use sensors and the sensorization that we are feeling or that we are experiencing around us. I will start here in this kind of a comic from an Italian magazine. I mean, 1962, long time ago. But it actually shows these kind of, if we call it social bubbles, in a very physical bubble. And this was a vision, how they spoke or how they thought that now in 2022, how would society look like? And unfortunately, I mean, this was a very good, I think, a good vision for the future, because we are principally there now in an abstract form. We are asked to have the physical distance, and we are asked to not to be too close to other people. And of course, this is what you see here in these pictures. I think it was very kind of visionary. And I think the person who did that was maybe experienced a little what Sergio was speaking about when you are the prophet, when you are doing something very innovative, that people like it or don't like it. So I will start to say some few words about INL. So INL is the Intergovernmental Research Laboratory, one of the very few intergovernmental research laboratories in the world. Other intergovernmental organizations are like United Nations. The most famous intergovernmental research laboratory, I would say, is CERN, the Elemental Particle Accelerator in Switzerland. But then we also have the EMBL, which is the Microbiological Laboratory, headquartered in Heidelberg. And then we have INL. So we are principally 3 research organizations that are intergovernmental. And INL is the only one in the world focusing on nanotechnology. So it was built about 10 years ago, a little bit more than 10 years ago. And it is kind of having an international outreach. So we're trying to connect internationally so we can have a connection to various countries. It's an intergovernmental, so we have member states as being our owners. So right now we are about 400 people there from about 40 different countries. And we are working heavily in order to make nanotechnology, or if we like, enabling technologies, to be deployed into society. So we are there in order to help society to grow, then put solutions or put possibilities there that would address societal challenges of today. So it's quite a nice activity that we are performing there, of course, but we do not only do it there. We are in other places as well. So we have representation in Scandinavia, in Israel, in Dubai, Hong Kong, Shanghai, Austin, Boston, and Brussels, and also in California nowadays. So we are kind of trying to think about and trying to help to develop things that will be very useful. About 1/3 of our activities are directly in activities with industry, where we put innovation into the market, going from, let's say, the research grade things indirectly into employment of high TRLs, so really into the market directly. We have a startup program, so we have incubated companies, of course. We are working with different kind of concepts like Scale Traverse program, which is an art and design and science program worldwide, where we have people coming, spend the time with us, and then putting up different ways to articulate science and how science can help. So if we're a little bit more focused, and we are working in 6 different areas. So one area is about the food for the future. One is in precise and personalized health tech. And this, I think, will touch quite a bit on what Sergio spoke about. Sustainable environment, advanced materials and computation, smart digital nanosystems, and clean energy. So these are the 6 kind of areas that we are focusing on. They are, of course, interlaced with each other. So in total, we have 25 research groups that are working in these areas. There is not one single group that is working in only one of these areas. So they're all working together. And this is one of the strengths of INL, is that we have people from all kinds of disciplines working together in a very strong, I would say, totally multidimensional, multi-scientific, multidisciplinary approach. So our mission is to explore interfaces between people, of course, between sciences, between engineering sciences and other sciences, but also between governments or between organizations, and of course between people. So the overall vision for INL is the four that you see in the bottom here: fostering a digital society, promote carbon neutrality and environmental sustainability, personalization of foods and medical nanotechnologies, and develop next generation disruptive computational technologies. So these are the four areas. I will not speak so much more about these four areas. I will go now into the more the kind of health perspectives or so. So if we think about where is health now, I mean, we heard Sergio speaking about the digital health and the possibilities within that and the telemedicine and so. If we think about where we are now, what are we facing? I mean, we're facing all these kind of, I would say, challenges: the aging population, urbanization, of course, the food supply, clean water, lifestyles, obesity, multi-sickness panorama, big data, history, experiences, etc. And then now pandemics that we're living in. And all these things, it's really limited by a cap, which is the health system, which is principally the taxpayers' abilities to pay for the cost to take care about all these things. And you have everything here is kind of interconnected with each other, right? So it's really a problem, I think, to make this. And what you need is to have a very holistic and inclusive perspective when you address the health, because health is not single. I mean, it's one part of the society, and it's a very big part, and we need to be able to do the health care in a little bit, or the health system in a little bit different perspective. One obvious thing is, of course, to bring together actors and creating this kind of enabling ecosystem that we need in order to address these, I would say, really big challenges, and also with the diversity we're having worldwide, of course. If we go to what we do at INL in our precise and personalized health tech cluster, so you see to the left, you see the health issues that we're trying to address: diagnostics, therapeutics, theranostics, drug delivery, biomarkers, and understanding. And then the engineering side to the right is where we are working. So we make sensors, really specific tailored sensors. We do a lot of microfluidics to do organ on a chip activities, etc. Fluid mechanics is very important. Electronics, obviously. NMR is very important. So we make handheld NMR instruments. Integration, photonics, microscopy. So all these things are there in order to aggregate some kind of understanding and possibilities within the health sector. So this is bringing this together, and everything is extremely interdisciplinary. So we have, as I said before, people from many different areas. So if we think about health in the digital society perspective, so if we look in the middle of this picture, it's a kind of a way to try to generate an understanding for where we are now in the digital economy or in the digital transition in society. So we have to have sensors. I mean, we need to measure something, and then when we measure that something, that needs to be communicated. It needs to be computed. I need to make some understanding. And nowadays, you use more AI and deep learning analysis activities, which you can call the smart society, if you like. And these things are then going back, because if you don't have enough data, then the AI, the deep learning will require more data. So you need to start over again and then make even more precise sensors that goes from having this kind of general perspective to be more specific. So we can put sensors in our bodies, we can put sensors in our environment, we can monitor air, water, wastewater, etc., etc. And all these things go together. So this is how the development has been, and I think the digital society has kind of, it's in 3 steps in a way. So when it became starting the digitalization, we started to we make tables out of things, and then we started to program, and then the computers did these activities for us as we program it. And now we're going into the cognitive system era, or if you like, the autonomy era, where we will have the help of the AI and the deep learning algorithms in order to help us to understand and interpret what we see, the data we are kind of aggregating and looking into. So we're going from a more an automated system into a more autonomous system, and we see this in all kind of dimensions, like the self-driving cars, for instance. So we see it in the electrification and in all other different kinds. So I think this is the general trend, that we have this digitalization in society. If we go for the mega trends now in the healthcare, so the telehealth that was discussed is a very important thing. Regulation about data privacy and how things are kind of interrelated with each other, and then that patients are more and more demanding this digital care, and they are not the blockers, so they are increasingly happy with that. But one very important aspect is, of course, who is owning the data, because if I contribute with my data, I have sensors in my body, I contribute with this data, and of course we need all the data in order to aggregate and get an understanding, but it's still my data, and I should also be part of the benefit. So I cannot just provide data for free, so we need to have a discussion about how can we secure that the data that you are providing will actually be, you will get some return on that data. One thing is, of course, you get better healthcare, if you like, but there are other perspectives as well. So the problem we have now, as I said before, is the ceiling. So we cannot spend how much money we like. I mean, there is a ceiling. And what we need to kind of change the paradigm is to kind of turn the pyramid upside down, if you like. I mean, start with the IoT, the technology stuff, and then see how that can go into the preventive care. So we do more preventive maintenance of ourselves, so more the industry 4.0 concept. And then we will be able to have much more better wellness. So it's more about securing that we're not getting sick by having more wellness, more care, rather than taking care about the guys that are sick. So by providing more healthy people in the world. So this is a kind of a paradigm. So if we just go into what we did at INL, so INL, we didn't work with virus at all, but then when the pandemic hit us, we did a lot of activities. So we really came together out of this external threat and created a lot of different things, including making facial shields for the health sector close to us, but also starting to develop different activities that everything is about how can we secure the confidence in society that people can actually go back in society. So we started to not do medical diagnostics, but rather screening. And we kind of made 2 different things. One, you can see to the left, we call it now the INL Safe to Go, which is a breath analysis that we do not care about the biological activities of anything. We just look on the particles, the physical particles that the COVID particle is. It is a physical particle with a very well-defined size. So we measure this in breath, and that will give you, if you're a spreader or not, that will give you the confidence if you can go to the street, you can go to the shop, you can go to the theater, football match, whatever you like, you can go back to society. It's not a diagnostic tool, it's a screening tool. It's something that gives some confidence. And then you can go to the other one, which is that we work quite a lot on now, is rapid saliva detection, which is a lab test, so similar to PCR, but much more quicker, where we have a very high specificity for the time being, and we're now building it into cartridge format, so it can be used for diagnostic purposes. So these are the 2 different activities that we put a lot of efforts into, and we are very close now to launch them into the market, having discussions with several entities now. So with that, I just say that I hope I managed to convey some things what we do at INF. It's we are really committed. So the the feeling at INL is a very passionate feeling. So we're more like an NGO in the way we are working. So really to provide value for society and saying no to everything that is just purely stupid things that has no real value for people. So thank you very much. And
thank you. Thank
Paul.
you so much, Professor Lars Montelius, and for keeping the time within the time. I think also a round of applause that I'm seeing from the participants in the room. If you're so kind to give a little bit of human arm to those presentations. Virtual does not mean distant. Thank you very much for your feedback and on this presentation. We are live on